Well, 2 years ago, during this month, the first COVID-19 case was reported in South Africa. Since then, the country has been grappling with the virus. Lockdowns and the state of disaster measures have wreaked havoc on the economy. The question is, are we winning this battle? We take a look at where we are in the fight against COVID-19 2 years down the line. Over 31.7 million vaccines have been administered in the country so far. At present, the push is to encourage South Africans to go for booster jabs, and that has started in earnest. But concerns are being raised that even though COVID-19 numbers are decreasing, a fifth wave can't be ruled out. eNCA's Heidi Giokos joins me now to give us an update on that situation. So 2 years on, Heidi, of waging a war and pushing back, as they used to say back in the days, pushing back the frontiers of COVID-19. How's it looking? What are the experts you've been talking to telling you about how we're doing?
We've come a long way, Tulis. I think back from March in 2020 and onwards, I think 2020 and 2021, mid-2021, have been extremely hard for South Africa. We had to go into hard lockdown. Extreme measures had to be implemented for the country to try and grapple with this. It was also very difficult for our government to try and understand how to deal with this, because nobody really knew or understood what COVID-19 was, how serious it was, how people were going to react to this. And the downside to all of this was that more advanced countries and economies were able to get their hands on the COVID-19 vaccine as soon as it was established that there was a vaccine, to try and prevent severe illness and death. But it seems as though the country has tried. Experts are saying that, considering where we come from, we have definitely come a long way. But the big concern is that many, and it's not just here in South Africa, many feel as though this pandemic is over, and because our numbers are so low, we can just go back to what we see as normal life. But experts are saying we must still be worried. There could be a fifth wave. There could be another variant that emerges. But we do know that there have been more recoveries than deaths. Of course, the deaths are very high. We've had over 90,000 deaths since the start of the pandemic, over 2 years. And we've had a lot of recoveries as well, mostly recoveries. But still, it has been a very tough and difficult year. So we spoke to Professor Barry Shube, who just explains what's been going on since the start of the pandemic.
We have made good progress. We've made excellent progress. You know, if you look back 2 years ago, before we had our vaccines, we were in a very much more vulnerable position than we are now. So we have made great strides. We made great strides, first of all, in developing our vaccines at breakneck speed. I can come back to that just now. We've also made great strides in understanding how the virus is transmitted. And we've had great strides in actually cataloging, or what you call epidemiological monitoring of the disease. So we have made great progress. We haven't conquered it yet. I must be quite honest. We are still at a stage that we're not sure when there'll be new variants or what the personality of those new variants will be. And I think this is where we still need to be alert. We still need to be vigilant.
Well, one of the things that happened, Heidi, is that before South Africa procured enough vaccines for everyone, there was a point where it was the only thing people wanted to talk about, how this government was not getting us the vaccines. Other countries are forging ahead and getting vaccinated. That's late 2020 into early January, February 2021. The vaccines came. There were long queues. Uptake was good. But it seems to have slowed down.
Completely slowed down.
Yeah.
The fact that we only have 17 million adults fully vaccinated is a very worrying picture, and government has of course highlighted this. They've come up with various campaigns to try and get people vaccinated, but it just seems as though government is not getting it right in terms of encouraging those who are just not interested in getting vaccinated to go out and get their jab. There's also concern that people aren't really interested in getting booster jabs because they feel they've already been vaccinated. Why do they need a booster shot. So government says there is some kind of comfort in knowing that the most vulnerable age groups are mostly fully vaccinated. So those that are 60 and above, those that are 50 and above. But it is, of course, a concern when it comes to the younger population and those also over the age of 25 to about 40 years old. That age group, it's also a bit of a problem in terms of them going out and getting vaccinated. And we saw now with Omicron variant, it was starting to hit people who weren't vaccinated, and it was that age group that weren't vaccinated. You're most likely to be hospitalized because of that. So government's saying, we've come a long way. I remember those queues. I remember standing at the airport waiting for those airplanes to land with those vaccines. I mean, it was seen as gold. We were all waiting to just get jabbed with that vaccine, and now vaccination sites are closing down because people aren't going, and there aren't as many vaccination sites because government is struggling, of course, to get people to go and get vaccinated. But the message is clear. Government saying the data shows it, the science shows it, vaccines do provide the necessary protection. But let's listen once again to Professor Barry Shube on what the country has done so far in terms of vaccine rollout.
I think there is a lot of room for improvement. The vaccine coverage is a bit disappointing. We should have got a lot higher coverage than we have achieved. But, if we look at the extent of immunity, in that respect, we're actually quite fortunate in South Africa, because it appears from many studies now, what we call seroprevalence studies. In other words, we look for the presence of antibodies in serum samples, blood samples from individuals. It appears that the infection itself, or shall I say natural immunity, has achieved, together with vaccines, a large chunk of our population being immune. And this is why we didn't, in our fourth wave, our Omicron wave, we didn't really see such severe disease.
Heidi, thank you. That's eNCA's Heidi Giokos there. Look out for more of her reporting reflecting on the last 2 years throughout the day here on eNCA.